Universal health coverage is a journey.
Is really the ambition that the health services that people might need to use are available, good quality and affordable.
It is not a final objective you reach or you don't reach. You are always on your way to universal health coverage.
There's many ways that it can be done and many paths. There's no ideal path.
The poor people, they are being impoverished because of the healthcare expenditure.
They don't have the resources accumulated to be able to pay for a hospital treatment.
And so if you're poor, a flat payment will be a bigger share of your revenue.
And therefore this comes as a shock to their family income.
And the consequences of that is that poor people, typically in a system where there's a lot of out-of-pocket payments, will access care less than they should, and as a consequence be less healthy than they could be.
The financing mechanisms for social health protection have to be based on general government revenues.
So government actually intends to protect the poor people from further impoverishment and improve the access of the poor people into the healthcare.
For the poorest in the population, they do not pay the insurance premium. The insurance premium is paid for by the government.
The poor families, every family will get a health card, and that will give them the entitlement for getting the specific benefit package.
Part of the explicit agreement with the hospitals is they won't get charged for things under the table.
The most important barrier to implementing social health protection is political opposition.
The two most important in this respect are financial sustainability and political sustainability.
Whenever you introduce a reform to benefit the poor, someone is going to lose, and often it is the most powerful group.
There are system challenges, there are political challenges, there are administrative challenges.
You need to improve the quality of frontline health services.
A key part of the design is that the provider organisations can be public hospitals or private hospitals. It sort of incentivises the hospital, in this case the provider organisation.
Getting better value for money is important, and one obvious example is not to pay too much for medicines, to use generic medicines, to make sure that there's no wastage and leakage of medicines.
The more they do of good quality services, the more money they get, the better they can reward their staff.
Government can now allocate money basing upon how much services has been delivered.